Okay, here we go. Well, welcome everyone. Thank you again for joining us today. This is the Town Hall series on COVID-19 and maternal and infant health, and we're so glad you could join us today for this conversation on COVID-19 vaccinations. For those of you that don't know EverThrive Illinois, or for those of you who do know us but haven't seen our new mission, vision, and values, we revamped them over the summer. And so our mission is to achieve reproductive justice in the healthcare ecosystem through community-driven partnership, policy action, and systems change. We envision a just and affirming healthcare ecosystem where individuals, families, and communities can thrive. And we center our values of reproductive justice, anti-racism, centering the most impacted, and bold action and transformation to carry out our work. So still focusing on all of the same issues, just being more intentional about and slightly shifting the lens through which we approach our work. Some quick housekeeping information for everyone. So we ask that everyone please keep yourself muted to reduce background noise during the Q&A. If it's easier to ask a question verbally than through the chat, we'll be able to unmute you then. We do ask that everyone hold off on asking questions. You can type them in as we go, but at the end we'll have a Q&A period where we'll get to the questions. And then just a reminder that we'll be sending out a recording of this presentation as well as the presentation slides to everyone who registered for the meeting. So our agenda for the day includes these introductions. Then we'll have a presentation on COVID-19 immunizations by Dr. Anita Chandra and Dr. Mia Lane, followed by a question and answer period. And then EverThrive Illinois' immunization manager, Ceci Tipiani, will share a bit about our COVID-19 campaign that we're launching soon. And then we'll wrap up and ask folks to complete a quick poll to help us evaluate the event. So gonna introduce our lovely speakers today. We have an excellent panel. So Dr. Chandra has been a pediatrician with Northwestern Medical Group in Chicago since 2001. Originally from Ohio, she received her MD from Northwestern University's Feinberg School of Medicine in 1995 and completed her residency at Northwestern Children's Memorial Hospital. Dr. Chandra maintains a strong affiliation with the medical school as an instructor in clinical pediatrics at Northwestern University. And over the years, she has worked in various capacities with the Illinois chapter of the American Academy of Pediatrics, including the Committee on Infectious Diseases and Immunizations, and currently serves on its executive committee. Dr. Chandra is a champion of childhood immunizations and is a media spokesperson for the AAP and Northwestern Medicine. Outside of work, she serves on the board of EverThrive Illinois and the Neighborhood Parents Network, and she is married with 4 teenage sons and enjoys reading, dance, and travel. Dr. Lane is a board-certified obstetrician gynecologist who practices in the Chicagoland area. She is the founder and medical director of a private OB/GYN practice in the South Loop of Chicago named Contemporary OB/GYN Chicago. And she actually just shared it was their 1-year anniversary, so yay to them. She's affiliated with Northwestern Prentice Hospital, and she received her bachelor's degree from the University of Illinois at Urbana-Champaign. She obtained her medical degree from Meharry Medical College and completed residency training in obstetrics and gynecology at Wayne State University, Detroit Medical Center in Detroit, Michigan. Dr. Lane currently holds leadership positions in the American College of Obstetricians and Gynecologists organization and has a strong interest in advocacy for women's health rights on a local, state, and federal level. And Dr. Lane is also a board member at EverThrive Illinois. And then finally, Ceci Tipiani Fuentes is our immunization manager and joined EverThrive Illinois in 2014 with a focus on increasing students' access to breakfast. Her role has evolved over the years, and Ceci currently provides immunization education and resources to community members and healthcare providers in order to ensure vaccination rates in Illinois. She continues to be an active community member who is dedicated to increasing resources and services to underserved communities. Prior to joining the EverThrive Illinois team, Ceci was a program specialist for an organization that provides after-school programming to youth, and she also worked in the field of HIV/AIDS prevention education. Ceci has more than 10 years of experience in the nonprofit sector, and her career has been driven by a passion for community advocacy. Through experiences at various organizations, Ceci has utilized her extensive program management and development skills to enhance the lives of others. So welcome so much to our three presenters. We obviously have a wonderful panel with lots of knowledge today to learn from. So now we can jump into the presentation, and Dr. Chandra, I'm gonna turn it over to you to start us off.
Fantastic. Thank you for that really warm welcome. And I think we'll be able to answer hopefully some of your questions just in the presentation, but certainly if you want to put in your questions for the end, we'd be happy to answer more. So we're going to break this presentation down into 3 sections. The first section is going to be about general information about the COVID vaccine for the general public. Then we're going to turn this over specifically to recently pregnant or lactating individuals. And then last, we'll talk about the vaccine recommendations for children 5 to 11 years of age. So if we talk about when we talk about the general population, we're going to first focus on the current vaccine recommendations, including the boosters, which you may have heard about more recently in the news, what to expect when getting vaccinated, and of course, additional ways to keep your family safe. So this is a sort of busy graph or a busy chart, but it gives you the current vaccine recommendations for the 3 different COVID vaccinations that are utilized in the United States. The first one on the left is the Pfizer BioNTech vaccine. The middle one is the Moderna column, and the one on the right is the Johnson & Johnson or Janssen product. You can see the ages that the vaccine is recommended. Currently, the Pfizer vaccine is the only one recommended from 5 to 17 and a half or 5 to 18 years of age. The other 2 are recommended, all 3 are recommended for 18 and over. The Pfizer and the Moderna vaccine products are both 2-dose vaccines. The Pfizer product is given 3 weeks apart. The Moderna product is given 4 weeks apart. And then the Johnson & Johnson product is a single-dose vaccine. Booster doses for the Pfizer vaccine and the Moderna vaccine are at least 6 months after the last dose in the series, and the vaccines are interchangeable for that booster dose. And then for the Johnson & Johnson product, the booster dose is at least 2 months after the first dose in all people ages 18 years and older. And again, the vaccine product can be interchangeable. You're considered fully vaccinated, however, after the initial series. So with the Pfizer and Moderna vaccine, it's 2 weeks after the second dose of the vaccine. And with the Johnson & Johnson product, you're considered fully vaccinated 2 weeks after the first dose of the vaccine. Next slide. In mid-November, the recommendations were updated so that all individuals 18 plus should receive a booster. This was the most recent recommendation by the CDC. And I know people ask questions about with children who were vaccinated earlier, but the vaccine booster dosing is recommended for 18 and up at this point in time. Next. So people need boosters to ensure the same level of protection over time. However, like I mentioned, you are considered fully vaccinated after the primary series. We like to think about vaccines, the COVID vaccine, similar to other vaccinations that you or your children may have received over time. Sometimes you need 2 or 3 doses to help build up your protection level. You do not need to restart the vaccine series, though, if it has been longer than 6 months from the Pfizer, Moderna, or 2 months after the J&J vaccine. And that is sort of standard practice with all vaccinations. And I want you to think about, what to expect when you're getting vaccinated. And certainly, I think this is a group of people who are involved in the vaccinating others. So these are things you probably already know, but in the arm locally where you get the vaccine, certainly you can have pain and redness and swelling at the site. Throughout the rest of your body, you might experience tiredness, headaches, muscle pain, chills, fever, or nausea. All of these, while not pleasant, are short-lived and are certainly a way of saying that your body is working. It's doing what it's supposed to be doing to respond to the vaccine that you've just received. Other things to note, the COVID-19 vaccinations are free regardless of if you have health insurance. They're also free regardless of immigration status. At times you may be asked to present a vaccine or your ID card or a insurance card, but it is not going to, you will not be billed for the product at all. Sometimes the places where you get the vaccine will use the insurance card to help get their reimbursement from the federal government, but it is not on you to pay for the vaccine. The federal government is taking care of all of that at this time. You can find a place to get your COVID-19 vaccine in Illinois at the following websites, certainly the CDC, vaccines.gov. You can go to EverThrive Illinois' COVID-19 webpage, which includes the IDPH and the CDPH websites. Lots of availability. We just want to get everybody vaccinated. In terms of additional ways to keep you and your family safe, of course, wear a mask. If 2 years of age or older, you are actually required in Illinois to wear a mask. We want you to continue to stay 6 feet away from others and avoid crowded places if at all possible. Stay home if you are feeling sick, except to seek medical care or to actually get a COVID-19 test. We don't want you to delay any emergency medical care or care for cancers or other illnesses. You want to make sure you're washing your hands frequently. I will tell you that as a pediatrician, this hand washing teaching that's been happening over this past year has been so excellent in our pediatric population. And of course, make sure you go out and get a flu vaccine. The COVID-19 vaccine does not protect against the flu, and vice versa. The flu vaccine does not protect against COVID-19. They're two separate vaccine products, both but very, very important. I'm going to turn this over now to Dr. Lane, who's going to talk specifically about pregnant people.
Thank you for that opening and that basic information about the vaccine and how it impacts our general population. I'm going to have a more focused discussion with everyone about how the vaccine and the virus is impacting pregnant, lactating women, and those who have been recently pregnant. So pregnant women with COVID-19 are at increased risk for severe illness compared to non-pregnant women. And that includes more likely to be admitted to the ICU, placed on a ventilator, which is a breathing tube and to help someone breathe when their lungs are not functioning well on their own, and to potentially die. The biggest risk factor is when you are symptomatic. So symptomatic pregnant women have an higher increased risk than the general population when they are infected with COVID. Pregnant women with COVID also have an increased risk of preterm birth and having their baby pass away prior to delivering them, which is a stillbirth. And while uncommon, there have been some infants that have been born with the COVID-19 infection, but sometimes we don't know if that infection was transmitted while the baby was still inside of the mother, or if that infection happened after the baby was born. Again, this slide just goes into further detail about what we were just discussing. So pregnant women that have symptoms of COVID-19 infection have a 70% increased risk of passing away from being infected and having virus complications. But with that information, only 31% of pregnant women have been vaccinated against COVID-19. And so our goal is to show how important the vaccination is, especially for this special population of pregnant women. So the vaccine rates are extremely low, as we mentioned on the previous slide, approximately 31% in pregnant women. And those rates vary based off of the race. And so Asian Americans have the higher rate of vaccine administration in pregnant women, while Latino and African American populations have lower rates, which kind of mirrors what we're seeing with the general population as well. Pregnant and lactating women, they're normally not included in vaccine trials or any sort of studies in the US due to them being in a vulnerable population. But recently we have been including them in trials to see if there's any additional information that we can retrieve. Over 177,000 individuals have shared information thus far about their vaccine status during the pregnancy. Some of the important things that we want you to take away regarding the vaccine is one of the biggest points is that the COVID-19 virus vaccine is not a live virus. Again, the COVID-19 vaccination is not a live virus. And so that means it's safe for you to receive in pregnancy, and it will not give you the virus. The vaccine does not pose a risk to a pregnant person or their baby. There have been no increased reports of pregnancy loss or any outcomes that are impacting the health of a pregnant person or their baby. But there's also research that shows that there's no increased risk on their fertility in the future as well. It's safe for pregnant people to get the vaccine, and it's also safe for lactating people to get the vaccine. And it's also beneficial because some of the antibodies that your body develops after receiving the vaccine can be passed on to your baby through the breast milk and potentially while the baby is still inside of you if the vaccine is received during the pregnancy. Some other key things that I want everyone to take away from this conversation is that we talked about the safety of the vaccine during any point of the pregnancy, whether you're pregnant or breastfeeding. And as far as which vaccine to receive, all three vaccines are safe to receive. You can receive the vaccine, as I mentioned, during the first, second, or third trimester in the pregnancy. There have been some discussions about the safety of the vaccine in the first trimester, and specifically in certain subset populations, such as people that have undergone in vitro fertilization or any assisted reproductive techniques, because those pregnancies have gone through so much to achieve them. It's sometimes recommended to delay the vaccine until the second trimester, but the standard recommendation is that the vaccine is recommended at any point of the pregnancy. Also, whether it's the Johnson & Johnson vaccine, Moderna, or the Pfizer vaccine, all people should receive the booster dose, 6 months for Pfizer and Moderna, and 2 months after your Johnson & Johnson shots did you receive your booster. And then as far as the side effects, so we mentioned that we should all receive the vaccine. You can receive it at any point in the pregnancy. The benefits to the pregnant woman, person, and their baby. And what are the side effects? Well, the side effects are the same to the general population. There have been some reports of people having changes in their menstruation after they received the vaccine, but we are seeing that those effects are not very common, and if they do happen, it's not long lasting. What we're thinking is going on is that anytime there's a stressor to your body, which is what's happening when you receive a vaccine and your immune system is revving up to produce that protection in the form of antibodies, your body receives that as stress. And so sometimes with stress, you can have slight variations to your menstrual cycle that are not permanent. And that's what we're seeing with the COVID vaccine. And so those small menstrual changes are not impacting people's fertility long term. The other thing is that that cycle will return back to normal within a month or two. Again, one of our biggest goals is to prevent pregnant people from being infected with the COVID-19 virus. One of the biggest things we could do that, of course, is receiving your COVID-19 vaccines in the routes that we discussed, masking, practicing COVID precautions, such as social distancing. Those are also ways to help prevent the spread of the virus, but the biggest thing is to get your vaccine. Again, the vaccine is safe for pregnant people and the baby, and it's been proven to be beneficial. It does not increase your risk of miscarriage or infertility. However, people that have been infected with the virus have had increased risk of preterm birth, stillbirth, and having babies that are admitted into the NICU. Over 200,000 pregnant people alone in the US have received the vaccine. So we're heading in the right direction, but we want everyone to continue to spread the word about how safe the vaccine is for pregnant women, pregnant people in general, and those that are breastfeeding and have recently had their children. Definitely, if there's ever questions you have about the vaccine, reach out to your women's health provider and have that discussion so that they may answer any questions like we're doing today for you.
Thank you, Dr. Lane. I actually love what you said, spread the word, not the disease. And we are, physicians, but you need to make sure that your patients or the people that you're taking care of also speak to their physicians or healthcare providers about any specific questions pertaining to their specific health or specific medical complications in their lives. So now we're going to shift gears and talk about the clinical trials for children 5 to 11 years of age, what we know about children that have received the vaccine, and I certainly want to address any concerns about the vaccination in this age group. So, clinical trials for the COVID-19 vaccine for children have been ongoing for many months. And while it seems like the vaccine was developed quickly, it still needed to pass through all of the safety standards that all vaccines must pass through. And I'm going to show you a slide that gives you a quick little idea of how clinical trials happen. The important thing is that there were no serious side effects found for children in the vaccine trials, and the vaccines were found to be safe and effective. So if you look at this graph or this cartoon that shows the journey of your child's vaccine, there are different phases to vaccine trials. When they first manufacture a vaccine, they have to make sure that it is actually going to do what it's supposed to do. And when they come to human trials, the phase 1 trial is around 20 to 300 healthy volunteers. And what they're really looking for is to see, is this vaccine safe and does it seem to work? When they get to phase 2, they're looking at several hundred volunteers to see what are the more common short-term side effects. And then when they come to phase 3 trials, hundreds or thousands of volunteers participate to really see how do people who get the vaccine and people who do not get the vaccine compare. The vaccines have to go through very, very careful, rigorous measures of trial and safety to make sure that before they even come to the FDA to actually be approved, and then before they make it to the CDC to actually be recommended. So while it seems like all of this has happened within the span of a year, know that the technology that goes into vaccination has been around for quite some time, has been researched for quite some time. And because the whole world was really having to deal with COVID all at the same time, so much money and scientific effort was placed on this throughout the world to really get us ramped up to where we are. So it's not like it just happened like that. It took a lot of effort, a lot of money, a lot of funding, and a lot of research to make sure that these vaccines are safe for your child. And then ongoing safety data continues to be monitored. There are systems set in place, not just with the COVID vaccine, but with other vaccines as well, to keep measuring any kind of adverse side effects or adverse events that could be happening. The VAERS system is the one that probably everybody has heard of, but that is what every person is supposed to report to if there's any side effects, problematic side effects or difficulties or adverse issues with any vaccine. And so the FDA and the CDC continues to very closely monitor vaccine safety post-licensure as well. The Pfizer vaccine is currently the only vaccine approved for populations under 18 years of age. And it's important to note that there are differences in the dosing regimen. The dosage for 5 to 11-year-olds is actually lower than that of 12-plus-year-old patients. It's only 10 micrograms for the 5 to 11-year-old population versus 30 micrograms for the 12-year-olds and up. And these recommendations are based upon clinical trials with thousands of children and knowing that younger children's immune systems respond well to the lower dose. Children have generally reported the same side effects from the vaccine as the general population. Rare cases of myocarditis or inflammation of the heart muscle and pericarditis, which is inflammation of tissue surrounding the heart, that were reported in a small number of children ages 12 to 17 were not seen in the 5 to 11 age group during clinical trials, which I think is very, very important to note. And the part about this that I think is very, very significant, for me at least, is while less children have died from COVID-19 infection than adults, there are still cases of extreme illness and hospitalization. And the fact of the matter is that no child is supposed to die from an infectious disease. And that's really, even one death is too many. And so while there are a lot of people who may feel like, well, it's a simple illness in young children, the important thing to remember is that they shouldn't ever be so sick. They shouldn't be missing school. They shouldn't be taking the illness back to their family members and getting other people ill. So children really do need to be protected against COVID as well. There is no evidence that the vaccine causes any long-term fertility problems, and the vaccine, like Dr. Lane described, is recommended for people who want to become pregnant in the future as well. There are currently clinical trials that are assessing the safety of the COVID-19 vaccine for children and infants 6 months to 5 years. Those are the next groups of people that we want to make sure we get immunized. Pfizer has broken this down into 2 age groups. There's the 2 to 5 year olds, and then there's the 6 month to 2 year olds. We're hoping that the 2 to 5 year old data is going to be available by the end of this calendar year, and really hoping that approval for this age group will come in the first half of next year. If that is the case, I feel like we're going to have just such a fantastic 22. Now, in terms of vaccine mandates, there are some employers who can require employees to get their vaccine as an employment requirement, and you'll need to check with your employer, or your patients will need to check with their employer to see if they offer time off to receive the vaccine. We know that schools have actually some schools, colleges, and universities have required this for their students. And we know that some schools actually have given time off to families to actually get their family members vaccinated. There are currently no requirements that children in the state of Illinois must receive the vaccine in order to attend school. There are a lot of vaccines, though, that we know that are required for school attendance. And so it is possible that COVID-19 vaccine may become required in the future. The process of that happening will take some time, though, and it really is going to be about availability, equity, and how to build this all into the vaccine schedule, and things that we're still having to learn, like how many times a patient may need to get this vaccine. We don't know yet about boosters for the younger age population. So there's a lot of information that still has to come out there on that dosing data. But it may be at some point in time that children may be required to get the vaccine in order to attend school. All right, so questions. I think that there already are some questions.
There was one.
Here, Michael Tatel's question on why is dosage based on age and not weight? Is that the question?
Yes.
Yeah, and so immunizations are based upon function of the immune system. And we know that younger individuals have a very robust immune system and are able to respond to vaccines more robustly with even fewer doses. We know that with, like, for example, the HPV vaccine as well. Younger individuals only need 2 vaccines, older individuals need 3. So with this vaccine, they were able to come down to the lowest dose needed to actually get an appropriate response in the 5 to 11 age group. I know I've been asked this in the office a ton. If my child is 11 now getting their first dose and they turn 12 getting their second dose, how does this work? And the answer is it is all age-based dosing. So the 11-year-old will get the 11-year-old dose, the 12-year-old will get the 12-year-old dose. And it's not about weight, it's about immune system and the immune system's robust response at the younger age compared to the older age. I hope that helps.
No, that was great. There's another question in there as well from Jacqueline. What is the best way to approach a situation where the medical provider told a pregnant mom not to get the COVID-19 vaccine? I'm a doula, and one of our participants was finally considering getting vaccinated until she found out she was pregnant and consulted her doctor, but was told not best to get it.
That's a great question. I see that frequently, where whether it's healthcare providers or family members are giving information that's based on their opinion and not based on the facts. And so we need to make sure that we're always spreading the facts. And so I would provide that patient or the member with resources just so they can see that it's not your opinion that you're recommending the vaccine, that you're providing them with the safety facts about what we know about the COVID-19 virus and the vaccine in general. And I think once I arm my patients with that educational material, they feel more empowered about the decision that they make about getting the vaccine.
Thank you. We had an additional question in terms of why does someone continue to get chills in their body periodically since receiving the COVID-19 vaccine, and it's almost been 30 days?
I think that's a tough question to answer because I'm not sure that I could actually prove that it's related to the COVID-19 vaccine. I think that individual person should definitely speak to their healthcare provider about any other causes of the problem for that individual. And if they really do feel that it is a COVID-19 vaccine result, then they should report it to the VA ERS system so that if there's a grouping of other people who have similar symptoms, then this can be discussed and investigated further.
Great, thank you. One additional one is, one argument I hear often from vaccine hesitant providers and other providers is why the FDA still has approval under EUA, not a full approval. Does it not mean that the FDA is still reviewing effectiveness and safety of these vaccines?
Do you want me to answer that, Mia, or?
You can go ahead and then I'll add in anything there.
So the Pfizer vaccine actually does have FDA approval for 18 and up. It's the Moderna and the J&J vaccine that are still under emergency use authorization. I think some of it has to just do with the application process to actually go from EUA to FDA approval, full approval. I mean, as we all, there's a bureaucracy to a lot of it as well. And so the important thing is we're seeing data of response and safety data as more and more people are getting vaccinated. I think that it's just a matter of application for the full approval.
We have another question that's come in. Does the vaccine affect a 7-year-old with a history of febrile seizures?
I'll answer this, and then if Mia wants to go back to add what she wanted to say about the prior question about the FDA approval, vaccines are contraindicated in anybody who has an active ongoing fever and who actually has an undiagnosed neurologic problem. Febrile seizures, though, are a response to having a fever. So as we counsel our patients about having fevers, anytime there's an illness or a fever, you want to make sure you get the fever under control. The same, you may get a fever as a response to a vaccine. You want to make sure you get that fever under control. The vaccine itself doesn't affect anybody with seizures. It's just about getting the fever under control.
Dr. Chandra, you pretty much answered the point that I was going to make with the FDA approval, in that there's just a process that sometimes takes longer and we just have to go through all the steps. So it's not that we're looking for more adverse reactions to the vaccine, it's just going through those proper steps that have been in place.
There was a question about a number that we can share later on in terms of reporting systems, but I think that goes back to what you mentioned, Dr. Chandra, about the VERIS system. There is another question in the chat as to why do adults who have primary care physicians at NW, I'm not sure what that NW is for, and request a COVID vaccine have to wait until April for a vaccine, maybe Northwestern potentially, they're saying?
Yeah, if that's Northwestern, you shouldn't have to wait. You just need to contact your primary care provider. The push out from the hospital system to get everybody vaccinated has been a little slow rolling just based upon vaccine product in the hospital system. But if you contact your primary care physician, you should be able to schedule that. Additionally, this is a little plug for Northwestern, some of the immediate care centers actually have walk-in hours for vaccines. So you just need to go to the Northwestern website and find out what's your ICC close to you, and you should be able to get a vaccine, walk-in hours.
Thank you. And yes, she did clarify that she was referencing Northwestern. You know, a lot of people suffer from allergies during this period. So what advice do you have in terms of having people distinguish between allergy and flu symptoms from cold symptoms, from, excuse me, from COVID-19 symptoms?
Um, One of the biggest things I want everyone to know is that if you're ever concerned, if you ever have symptoms that might be similar to COVID symptoms, get tested. That's the only way you're really going to know if your symptoms are COVID related or not, especially in high risk populations or people that have pre-existing conditions and other comorbidities. So especially in the pregnant population, I encourage anyone with questionable symptoms to get tested to know for sure if what you're experiencing are COVID symptoms or symptoms related to the flu or the common cold virus or allergies, because some of them are very similar and overlapping.
And particularly in the pediatric population, there are several patients who will have very overlapping symptoms between RSV and the flu and allergies and COVID. And it's just important to know what the risk factors are in the population, what the vaccination rates are in the population, what the rate of infection is in the city or the area you're in. But the only way to really know is to actually do the test. I know, so there was a question about if my child has a cardiac issue, strong cardiac issues, should they stray away from the COVID vaccine? Absolutely not. If you actually have cardiac issues, then I'm assuming that your child is under the care of a cardiologist, and the cardiologists are absolutely recommending COVID vaccination because you don't want to add that infection onto an already compromised situation. In terms of evaluating or sort of follow up for any risk of cardiomyopathy or pericarditis post-vaccination. Again, this is something that you're going to need to be in touch with your specific healthcare provider, but the symptoms of those illnesses are something that your healthcare provider should be able to help you with. You should be monitoring for symptoms at all like that. And the studies that were done in the 5 to 11 year age group showed no cardiomyopathy post-vaccination. And in the older 12 to 17-year-old age group where there were some cardiomyopathy situations, they were all self-resolved, and it was all about monitoring very carefully and being aware of the symptoms that could be there, which would be symptoms of severe fatigue and severe lethargy and any difficulty breathing post-vaccination. And then there's another question, I think, about wearing a mask and so practicing social distancing. Would you recommend traveling at this time? This is a really difficult question to answer in a broad way. I think everything is about risk factors. You want to think about, how do you minimize your risk? What are the risks and benefits of what you're doing? And how many people in your party are vaccinated or unvaccinated? Where you're traveling to, is that an area of higher risk? It's a risk benefit situation for every individual. We have to think about people's mental health as well. We have to think about getting people to be in school safely. So it's really hard to just blanketly answer it. I think that if there are things that you could avoid that put you at increased risk, you should avoid them.
As a pregnant lady received the vaccine during in the beginning of her pregnancy, that means she can receive the second and the booster dose during the pregnancy?
Can you repeat that question again?
If a pregnant lady received the first dose in the beginning of her pregnancy, that means she can take the second and booster dose during the pregnancy?
Yes, so if to follow the same guidelines for the vaccines that are published with the getting the vaccines at the recommended periods in between, and then for the booster, the 6 months after for Moderna and Pfizer, and 2 months after Johnson and Johnson for the booster. If that falls into the window of your pregnancy, then you should definitely get the vaccines at those recommended times. And then just to add, there was another question in the chat about which, is there certain trimester recommendations for the vaccinations? There are no specific trimester recommendations. The American College of OBGYNs, which we call ACOG for short, they're the ones that determine the recommendations in the United States. And the recommendation is that pregnant people can get the vaccine, the COVID-19 vaccine, any 3 of them at any time of the pregnancy.
Thank you.
You're welcome.
Great, thank you. So one additional question was, do you need a booster to be considered fully vaccinated?
No, currently the guidance is that if you've received 2 doses of your Pfizer or Moderna vaccine, then you are considered fully vaccinated 2 weeks after the second dose. And with the J&J vaccine, you're considered fully vaccinated 2 weeks after that single dose of the J&J vaccine. You know, more and more information is coming up. Of course, what they're looking for in terms of making recommendations is based upon breakthrough illness and rates of disease in the United States and around the world. There may be more recommendations that come to, and which is why it's so important to keep up with the current information through programs like this. But at this point in time, you are considered fully vaccinated with with that initial series.
There was 2 additional questions that came in. Lactating women who received the COVID-19 vaccine would generally pass the antibodies to their babies, which is something you all shared earlier. Would the same apply to children under 5 if they decided to blend it into a smoothie?
So I think myself and Dr. Chandra can tackle this question because it's asking about lactating people in about the pediatric population and how they receive protection from their mothers. And so when it comes to lactating people, when you're breastfeeding, there is a potential that you can pass the antibodies to the baby to offer some protection. That actual amount of protection, whether it's complete protection, how long that protection lasts, is still being researched. But what we do know is that there is some passage of antibodies to a newborn baby. This is totally different from giving anyone else the breast milk to give them added protection. And so it's still recommended for the pediatric population to get their own vaccines so their body can have the level of immune response to protect them from the virus. And so I'll just turn it over to you, Dr. Chandra, to
yeah. And I will tell you that I've had a lot of new parents ask to have their children's antibody or their baby's antibody levels tested. And it's just in my patient population, I have seen positive antibody levels in babies whose mothers received the vaccination during pregnancy. But I have not in my own patient population seen any transfer of antibody through breast milk. It's, you know, it is theoretical. We are very hopeful that there is some antibody transfer. We also don't know at what measurement level there is protection. That's one of the trickiest things about checking antibody levels in any patient population is we don't know what that level is that you need to have to be considered as fully protected. So, you know, is it advisable to have somebody share their breast milk or pump breast milk and put it into an older child's smoothie or something like that to give them antibody? I don't know that that's an advisable thing to do at all. Do I think it would be harmful? I can't say that it would be harmful, but I don't think that it's necessarily advisable to do. So if that helps you answer the questions from the YWCA.
Yes, and there was an additional question in terms of the Pfizer vaccine. So if you receive both Pfizer vaccine doses, could you receive the Moderna for the booster and vice versa?
Yep, right now the booster doses are considered interchangeable, which product you use.
And that's including J&J as well?
Yeah, it is actually interchangeable. All 3 are considered to be interchangeable.
Okay, something that I will share with you guys, you know, at the YWCA will be helping our community to scheduling an appointment for boosters and for children's. And this is in Lake County, but we we noticed that everybody can do this, and it's very simple through CVS, Walgreens, Jewel. Everybody's offering the vaccine free. So, if you guys know someone who needs it, it's very simple to schedule that appointment.
Thank you.
Cheers. That's perfect information.
Yes.
I think that we've covered most of our questions here.
I was gonna say, any final questions folks have, either that you have yourself or that you've been hearing from other people? We definitely want to make sure we answer everything that we can before moving on.
There's one that, I don't think it's as popular anymore, but initially we were hearing often about in terms of which brand of COVID vaccine should one get, which one's better per se than the other.
The one that's in
to
your
address
arm.
that one.
The one that's in your arm is the best one to get. So whichever one is available to you, you should get. And it seems like there's plenty of vaccine availability. You just have to reach out and get it. So whichever one you can get it in your arm and get yourself protected.
Great, thank you.
And just to add to that, I agree 100%. I think some of the vaccine hesitancy in the pregnant population was this potential risk of blood clots. So pregnant women are already at an increased risk for having blood clots. And there was, with the Johnson & Johnson vaccine, there was a rare brain blood clot that was happening. And that's what caused a lot of fear. The research has proven that clot is still extremely rare for the general population as well as pregnant populations. And so there's no restriction to the vaccine for pregnant populations. And just like we mentioned, either of the three vaccines, whichever one you have easiest access to, is the one that you should receive, and they're all safe.
I will just add the caveat that that's not the case with children 18 and younger. Or 17 and younger. You have to get the Pfizer vaccine. That was the only one that is approved for 5 to 17-year-olds.
Great. Now we'll switch back over to the presentation. Now we'll share some resources. I will say we're going to send out a recording of this afterwards, as well as the presentation slides. So we'll definitely make that available to everyone. Okay, I'm going to go ahead and share my screen, and I'm going to turn it over to my colleague, Ceci, who's going to share a little bit about EverThrive's upcoming campaign.
Yes, so thank you, Kristen. And I seen there was a few comments, questions, particularly around resources. So EverThrive is really excited. We are in the process currently of developing a COVID-19 immunization campaign that we expect to launch very soon within the next 2 weeks. We've actually titled this campaign Understanding COVID-19. We really have been fortunate to work with an amazing social media consulting company to develop this campaign. We've worked with them on several other campaigns, so we have a long history with them, and they understand our mission and our visions, what definitely helps us when we approach this campaign. We realize, this COVID-19 has been very challenging, and there's been a lot of information circulating, and it continues to circulate for people. And really the heart of it is trying to understand, both from the medical professional side as well as from the average consumer side, is how do we understand COVID-19? So we thought, choosing that title would definitely be appropriate for this campaign. And this will be a social media digital campaign, primarily through the social media platforms, but it will also have a web page link that, once it's fully available, we will be able to share with all of you on the call. For this particular campaign, we decided we wanted to target specific audience. So we really decided that, pregnant people and recently pregnant people were individuals that really had a lot of questions and needed a lot of information. So throughout our campaign, we're really sharing key information, key questions circulating that will address a lot of, some of the things that have come up in this town hall today around risks and assessing benefits. The other audience we really wanted to target was parents and caregivers, considering the timeliness of the COVID vaccine available for the over 5 population. And as the physicians on the call mentioned, there is clinical trials for under 2 population and 6 months and older. So we really know that, parents, including caregivers, such as grandparents, play a big role in terms of understanding and making decisions about the healthcare of their loved ones. So we really wanted to provide them with the information, resources that they need to make an informed decision. The other key immunization stakeholder we recognize in communities is faith leaders. A lot of communities rely on their faith leaders to provide information, education, and resources, and even making decisions about their healthcare. So we will incorporate information and resources for faith leaders to utilize when talking to their congregations about whether they should make the decision to get vaccinated, and really having the key facts around the COVID-19 vaccination and immunization options. And then generally, the information will just speak to the general population. We will provide key facts around COVID-19. We really took our time in finessing and going through some of the most commonly addressed questions or concerns around COVID-19 and highlighting those with providing both simplified but long answers that connect to resources. So if individuals want to identify where this credible information comes from, they can follow the link and go directly to that website. Next. So as I was mentioning, our objective with this campaign is really to educate and empower people to make decisions that are accurately and scientifically based. We know there's a lot of information circulating both within communities and on social media about what COVID is and what COVID isn't. And it's a lot of information to dissect and digest. And so we really wanted to make it easy for people to have the most accurate and current up-to-date information at their disposal. And we will, through this webpage, share additional information and resources, particularly with some of the targeted media ads that we will do to some communities that we identified and that we work with more closely. We were able to develop some key messages that will address some hyper-local myths that have been circulating within those communities, and again connect them to some credible resources, because we know that you can go on Google and you can find thousands of things around COVID, but it's hard to distinguish what is accurate, is this trusted, is this not trusted. So we've done a lot of the homework for people already. Move on. Thank you, Kristen. And so, like I said, we are very excited. We're almost near the home stretch of finalizing that campaign. We're working with our team. We actually had hoped to have it launched already, but we really want to make sure we're getting our graphics correct and all those final kinks worked out when you're developing a web page. But we will be able to have this web page launched before the end of December, and it will run up until April with active campaign messaging happening. But the website will still be available even after April. And as I was mentioning, we do have some community areas that we are specifically targeting. We will target some specific ads, and we selected these areas particularly because these are areas we work with within the community outreach we do, but also these are areas that have been identified as low vaccination rates. And so collectively efforts are on all fronts are working towards really increasing vaccination rates, particularly in areas where we see low vaccination rates. So we have a great community engagement outreach team who will be utilizing door hangers that they will leave door to door, different key areas of the community as well as households that will have a QR code link that will direct folks directly to this webpage so that they can find out more information. In addition to that, we've developed these small business-like campaign cards that will also contain our code that will direct folks to our page. And the great thing also about our campaign page is it will be bilingual. So for our Spanish-speaking audiences, they will have the opportunity to get the materials in both English and Spanish, as well as the webpage itself will be able to be translated in Spanish. In addition to that, because as we mentioned, one of our target audience is pregnant people and recently pregnant people, we know that there is a lot of information and a lot of confusion around when and how individuals should get that COVID vaccination, how it would impact their pregnancy. So we are developing a COVID-19 resource that we will be able to share with folks, that they can share with the families or communities that they serve, that will really highlight and break down some of the key facts that pregnant people and recently pregnant people will need to know when making the decision to get vaccinated. So, really thankful to all the participants today for sharing some of these great questions. I think this gives us some additional takeaway points to cover some of those handouts and those resources that we're developing. And so I really encourage folks, especially if you have a close relationship with some of my other colleagues, that if you have specific questions that you see commonly circulating among the community areas that you're serving, that you share that with us. That's very informative to us as we develop these campaigns, as we develop resources, as we develop our COVID-19 webpage resources. We like to stay current on what we're definitely hearing on a community level. So feel free to share that information with us as well. And so we will stay tuned for our COVID-19 campaign webpage. You may see some different images. Right now, this is, the mock webpage, and we haven't finalized the images, but stay tuned. And we thank you all so much for joining and sharing these great questions. Very informative.
Thank you, Ceci. As was mentioned, well, afterwards, when we're sending out the materials, we'll send those out right away. And then once the campaign launches, we'll also send out information for you all to participate in the campaign as well. So a couple more resources and final information before wrapping up. So I also wanted to highlight another one of EverThrive Illinois' resources that we launched last year. It's called the Healthy Choices, Healthy Futures Perinatal Education Toolkit. And it's a one-stop shop of resources for individuals that are on their reproductive journey. And so resources on the website are broken down into the pre and interconception, prenatal, and then postpartum stages. And it includes evidence-based resources and information on a wide variety of topics for each of those perinatal periods. So as folks are looking for other resources on other topics, not just related to COVID-19 vaccinations with pregnant or recently pregnant people, this is a great resource for folks to check out. Next step, so as mentioned, materials from today will be emailed out to everyone, including the handout and this video. We have a brief anonymous poll before we wrap up, just to get your feedback. So if folks can stay on for another minute, that would be great. And then our next town hall is tentatively or probably taking place on Monday, March 14th at 1:00 p.m. And so when we send out the resources afterwards, we'll also have a link to register for that next town hall event. Before I launch the survey, I'll just say we have a bunch of citations here, and the one on CDC, the COVID-19s while pregnant or breastfeeding, they right now also have some infographics that are on their website that I think are, great to share with pregnant people if you're looking for handouts and things now. So I'll go ahead and share that link in the chat. And if you scroll down again all the way to the bottom, there are resources both in one, this is a great place for information, but then also there are some links at the bottom on like how to protect yourself and your baby, some posters, things of that nature that might be helpful as fact sheets now for individuals. So thank you again so much for joining today. I'm going to go ahead and launch this poll. Oh, shoot. It says I'm logged on from another location. Let's see. Ceci, do you mind hopping off for a second and see if I can launch it afterwards? Okay. Let's see if it'll work now. Oh, shoot, it's still not working. Oh, share this citation slide again. Yes, I'll share this one more time before we end, because it seems like the poll is not going to work. So I'll say thank you so much, everyone, for joining today and all the questions and engagement. If you have any other questions, definitely feel free to reach out. My contact information is on the last slide that I'll get to after this. And we hope to see you all at the next town hall meeting. Thanks so much. And here's my contact information. Okay. And they'll be sent out afterwards if folks that didn't get a chance to get it. Thank you everyone for joining. Thank you to our wonderful presenters. We'll see you at the next town hall event. Enjoy your day.
Thank you, everybody. Stay safe.
Bye-bye.